I'm John Shadegg, and I've been working on health care reform since I came here in 1994. This is the bill. Actually, it's the bill we can see so far. It's been out standing there for almost 4 months, and there are more than 500 pages of amendments to it, but it's never been integrated. You cannot get a copy of this bill with the Commerce Committee amendments put into it. Why? Because they won't release it. Because they're writing this bill in a room with a closed door, cutting one deal after another. Let me just tell you, health care reform is something I believe in and I've fought for. There are things that need to be fixed. But the American people are asking one question of this Congress. Why? Why are you doing it this way? Why, to reform health care, do you have to hurt the seniors in America by damaging, as Dave pointed out, by damaging their Medicare and their Medicare Advantage and threatening to take it away? Why? Why do you have to destroy the current employer-based health care that some people like? The president says over and over again, like Mike Pence said, that if you like your care, you can keep it. It's just not true. Open the bill, because in the bill it says in plain language, every policy in America must change in 5 years, whether there's a public plan or not. It has a grandfather clause. It says policies can stay as they are for 5 years. At the end of 5 years, every plan in America must be changed. And it must meet every dot and tittle of the rules prescribed in this bill, covering what the bill says must be covered, charging what the bill says must be charged. It says, for example, that the differential between the youngest person and the oldest person can't be more than 2 to 1. You know what that means? They either have to undercharge seniors, trust me, they won't, or they have to overcharge the young, because it costs a lot more to insure a 65-year-old than it costs to insure a 22-year-old. Not 2 times as much, but probably 4 or 5 or 8 times as much. Why do you have to change that? Why do you have to change employer-based care? Why do you have to have seniors lose Medicare Advantage? We could reform health care. Republicans want to fix pre-existing conditions. We're willing. Every Republican bill, many of them, by the way, extolled by, the ideas in them extolled by the Chicago Tribune, Obama's home newspaper today, in an editorial, takes care of pre-existing conditions, takes care of universal coverage. But instead, we're damaging the single mother who already has employer-based care she likes, and we're damaging these seniors. The American people don't want this, but they sure seem to see it before it gets voted on, like those seniors told you.